and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could do tonight, and so let's get started on those questions. We have one from a patient who said that she had been having recurrent urinary tract infections, wonders if it could be related to stress. A lot of stress going on. She's a care provider at her home. She'd been on macrobid, didn't seem to work. She was placed on Levaquin, doesn't seem to work. What could be the problem? Could it be stress?
Well, it could be stress. I mean, some women get a cystitis that's more of a chronic, a feeling of urgency and irritation, and so sometimes there's things other than antibiotics that can help that. But I'd also be worried. I'd also want her to maybe be examined to look for yeast infection or atrophic vaginitis, where you lose estrogen, effect on the tissues, and sometimes restoring the health of the tissues, and it can help those symptoms more than any treatment.
Right. Our OBGYN in Brookings, our oldest one, when he was doing his residency, and he did his research on vaginitis. And if I told that story to him, he would just roll his eyes. He'd be angry at me for having not treated this person correctly because the antibiotics wipe out their normal flora. You don't have a grass in your yard, and now weeds will come in. Yeah. And that's what you've got there. So I'd get to a really good OBGYN doctor. I agree with you totally. Yeah. Any other comments?
No.
We have a Facebook viewer asked if there's benefit to copaiba essential oil. Now, I mean, there's a lot of people taking oil capsules of a variety of different kinds. None of it is really perfectly sure that we're getting those
or
oils.
Scientifically based or anything else with it, so really
Although,
don't have a...
I guess I would say there's a benefit to relaxation, and you know, if you can relax yourself, and I'm not sure how one does that through meditation or exercise, or for some people it is putting music on or an essential oil. So there might be some improvement there, but as far as using those to cure a condition, or the studies probably aren't there, and again, you don't know exactly what you're getting.
If you talk about rubbing in essential oils, I know that just the rubbing matters. People talk about...
And that's where probably more the benefit is.
Right, someone giving you the attention. And I've often told people to put on topical icy hot or some of the things when you have a joint problem, and have your partner rub that in good and massage it good. That's a wonderful thing. I mean, a massage is a wonderful thing.
Right.
Yeah.
And if they were getting benefit, I'm never going to argue with them. If it's helping you,
I don't think there's any harm to this type of thing, but I don't know the scientific.
Right.
A Facebook viewer asked, when do you remove a parathyroid adenoma?
Well, there's some, I'll have to
come back to
there are some pretty strict guidelines for doing that, and I may not recall all of them, but I know that if they're getting complications when you have a parathyroid adenoma, you're getting your calcium levels are often too high in your blood, and that can cause problems, especially kidney stones, but it also can be pulling calcium out of the bones, so people get osteoporosis.
And it might be one reason why people have osteoporosis. They should get a workup for parathyroid disease, not the Fosamax.
Yeah. So when a person has bad osteoporosis, removing the parathyroid can help correct that, and it can also reduce their chance of kidney stones and other complications. Sometimes chronic severe pain or arthritis pain can get better if they're having arthritis from the calcium crystals. So.
Right. And then some of those parathyroid tumors represent the risk of other kinds of tumors with the MEN syndrome.
Yeah.
So certainly you want to have somebody monitor for other kinds of, for thyroid, not just parathyroid, but it's a different thing altogether, thyroid and adrenal and so on. A woman from Watertown asks, at what point do you recommend surgery for hemorrhoids? Dan?
If the conservative treatments are not helping and they're having pain that's not controlled, then the surgery would be an option. This isn't the first option because there are a lot of other things that can otherwise keep it in check. So it just depends on how much it's bothering them and how aggressive they would want to get.
Right. Sometimes when you do surgery, you end up with scars.
Right.
And you lose your continence.
That's right. So like I said, it has to be to me, would have to be pretty significant to go down that route, because a lot of the other things that we can have for suppositories or even the different type of toilet paper and everything else with it, as far as what you can end up using to not have recurrent flare-ups with it, can end up helping.
Right. If you're not constipated, you're not sitting hours on the toilet, which is pushing.
Don't read or check Facebook on there. And
check Facebook somewhere else. So, a man from Brookings asks if excessive intestinal gas is a symptom of a treatable condition. I mean, I often say that gas is from root vegetables, fruits, high fiber, milk. Gee, if you're having a lot of gas, then it means you're eating right.
Sometimes
But
if you have constipation, you might have some gas in between that. I think some people don't realize that sugar-free gum, sorbitol containing foods can cause gas, and that's a common one. And and
that's a good television.
Maybe even a little diarrhea sometimes.
Yes.
So
sorbitol is a good thing if you're constipated.
yeah, I'm trying to think. There might be
other reasons for gas. I think there are malabsorption syndromes, and certainly, if there is gas, I would look for people who have an inability to tolerate gluten. So a gluten enteropathy.
and people on CPAP and BiPAP have more with
force
just
in
the
the air.
air.
They're swallowing air. Air swallowers are nervous. That's it.
So
and
a good history.
Yeah.
Yes, and if they've had Whipple surgery, that'll do it to you too. But there's not a lot of Whipple surgery patients out there, but I'm one. But I'm not going to go into that particular issue here. But I love my forgiving wife. Let me put it that way. So, all right. So I think that's it for our questions from tonight. Let me see. I think we've hit them all. We thank you for joining us on our Facebook page. We appreciate all your questions and the opportunity to answer them. And we thank our guests again for the joy of their company and their expertise.
Thanks for letting us be here.
Yes, thanks.
You're very welcome. So until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.